So there are a couple of differences that patients should know between a silicone and a saline implant. Really, silicone implants are kind of the more popular implant. These are the ones that everyone thinks about. It's a silicone shell with a type of silicone gel on the inside. These are also considered what are called gummy bear implants, in the sense that if I were to cut the implant, it's not the old-fashioned liquid gel that used to just kind of pour out. The new generation of implants have this special cohesive gel where it's like if you cut a gummy bear, the jelly kind of stays firm and it's solid. So if this were to rupture or there was something, a problem and there was a leak, it doesn't actually pour out, it keeps its shape pretty well. So these implants are quite safe compared to older generations of implants. And in fact, they're actually equally safe with the current saline implants. Saline implants are also a silicone shell. However, the inside, instead of having this kind of cohesive silicone gel, it's actually salt water, so saline. So here's an example of kind of a saline bag, and you can kind of see the liquid that's in the bag. A lot of patients think, oh, well, you know, I'd rather have saline in my body versus silicone in my body. But you do have to realize that saline implants are still covered in silicone. So you will always have some type of silicone in your body. There are a couple pros and cons to each type of implant. The most obvious one is what happens if the implants break. So if a silicone implant were to rupture or to get cut, what happens is really not much. The implant will slowly kind of lose its integrity and shape over several weeks to months. You might notice that one breast is starting to feel a little bit sore or the shape is starting to change. Then we would send you to get an ultrasound and MRI and we can see whether your implant is still intact. On the other hand, if you were to have a saline implant, that's much more obvious. Once you have a leak or a cut, the saline just pours out of the implant, your body reabsorbs it, and your breast literally will just deflate. When it comes to detection of a leak or of a problem, the salines are obviously much more obvious, but the benefit of having a silicone leak is that it doesn't really change much, so you kind of have time to kind of go to the doctor, get scheduled for surgery, and have your breast implant replaced. But there are also a couple other benefits to having silicone implants. Number one is the feel. I personally feel that silicone implants are the most natural. They feel the best and they kind of react more like regular tissue versus you can imagine kind of like a water balloon does not feel as natural as a gel. With saline implants, any type of movement, it tends to ripple a lot more. So overall, I personally recommend patients get the silicone implants. Remember, all implants are covered in silicone, so you can't avoid it either way. But with the silicone fill, they definitely feel more natural. And they also tend to ripple less. And if you were to have a rupture, you kind of have a couple of weeks to work on getting an implant replaced versus having to rush to get surgery to get it replaced.